AshokSeth, let me ask you first. I want to understand what could really be the reason behind this sudden spike in the COVID cases in the national capital. Is it the double mutant, or there's some other reason? Is it because people, are not really adhering to the protocol, not wearing the mask properly? What is the reason that suddenly over the last few days, case count has seen a sudden spike?
You asked the right question, and I'm sure everybody's looking at that, but it's multifactorial. You know that we've had COVID fatigue, the public has had COVID fatigue, but unfortunately, the public also felt that because there was a decrease in cases after the last wave, that perhaps all that is gone. It's behind us. We've had a victory over the virus. And both because of confidence, callousness, carelessness, and COVID fatigue, everyone started having a merry time. That's why you saw all those visuals of markets with swarming people, absolutely people with masks down. Now, along with that, as you know, many things did not add up. Firstly, of course, those visuals of political rallies, of people ignoring the COVID-appropriate rules. And what one did not expect, while we all knew that there would be a second wave, the virulence of the variant viruses was unexpected. So while we knew that it was going to come, what public and perhaps the policymakers did not realize is that the viciousness with which it would come, the multiplication factor and the steep rise, which perhaps was unprecedented. And that's why we're in the situation now, as it appears, which is crossing 20,000, no respite in sight, unfortunately, beds full, people being unable to get, infrastructure struggling, and perhaps lack of oxygen and ventilators and drugs, as we see of today. So it's clearly a very worrying situation, but I would say we brought it upon ourselves. We had an enemy. We all had to get together. We were at war, and we had to kill that enemy, and we only did everything to propagate and help that enemy, unfortunately, and that was the virus.
Okay, I think those are very important observations you've made, Dr. AshokSeth. Mr. Rakesh Mishra,